Mental health is an essential part of your overall well-being. And in this video, we'll discuss mental health coverage, how employee assistance programs work, and how to access the resources available to you. Understanding mental health. Mental health affects every aspect of our lives: how we think, feel, act, handle stress, connect with others, and make choices. About 1 in 5 people in the US will experience a mental health condition this year, making it an important part of healthcare. Some mental health care basics to keep in mind. Mental and physical health are closely connected. Mental health conditions are common and treatable. Acting early often leads to better outcomes. Mental health care is a covered benefit in most health plans. There are different types of mental health providers, each with specific training and approaches. Let's give you a rundown of who's who. Psychiatrists. These are medical doctors who can prescribe medication. They diagnose and treat mental health conditions. They often work with other providers for comprehensive care. Psychologists. They have doctoral degrees, but they aren't medical doctors. They provide therapy and psychological testing, but cannot prescribe medication in most states. Therapists and counselors usually have master's degrees in counseling, social work, or related fields. They provide various types of therapy and support, but they focus on different areas like family, addiction, or specific techniques. Finding the right provider may take time, and it's okay to try different professionals until you find a good match. Your mental health benefits. Most health insurance plans cover mental health services. This is including outpatient therapy with in-network providers, psychiatric services and medication management, inpatient treatment when necessary, substance abuse treatment. Mental health service should be covered at the same level as your physical health services. You might hear this called parity in your plan documents. EAPs provide free, confidential help for personal or work-related problems. What EAPs typically offer are short-term counseling, usually somewhere between 3 and 8 sessions, referrals to other services and providers, help with work-life balance challenges, resources for childcare or elder care, legal and financial consultation, and stress management resources. It's completely confidential, available 24/7, no cost to you, and it's available to you and your household members. You can access it by phone, online, or in person, and it's separate from your regular health insurance. When to seek help. Consider reaching out if you're experiencing a tough time finding care for kids or elderly relatives. Confidential questions about substance use, high stress, anxiety, or depression, or even just feeling completely overwhelmed by daily responsibilities. Remember, seeking help is a sign of strength, not weakness. How to access your benefits. For mental health coverage with your insurance, review your insurance card or benefit summary documents to confirm coverages for specific services. Look for a behavioral health or a mental health service in your area and confirm if they are in network prior to accessing care. Call the number on your insurance card to obtain a list of in-network providers, or you can go on their website. Check for copays and session limits to avoid surprise billing. For EAP services, look for your company's EAP information in your benefits material. If you have any questions, contact your insurance carrier on the number listed on the back of your ID card, or call the EAP team directly. Counselors are available 24/7. Services are completely confidential, and your employer will not know that you've used them. Taking care of your mental health is just as important as your physical health. Don't hesitate to use the resources available through your current health plan. If you have questions about accessing care, your M&G employee benefit advocates, HR department, or insurance provider can help. And that wraps up our Benefits Explained series. Thank you for watching, and stay well.